Ever wondered why so many expecting mothers experience pelvic pain during their pregnancy journey? It's quite a common occurrence, affecting a significant proportion of pregnancies. This discomfort can be due to the natural changes your body undergoes as it prepares to carry and deliver your baby. Hormonal shifts, weight gain, and the baby's movement can all contribute to this sensation. However, while it's a common part of the pregnancy experience, it's not something you have to simply endure. In fact, there are numerous strategies that can be employed to manage and alleviate pelvic pain during pregnancy. This video is here to provide a step-by-step guide on how to do just that. We'll be delving into various exercises, lifestyle changes, and other tips to help you navigate through this journey with greater ease. Remember, while pelvic pain is common, it's not something you just have to endure. Let's find out how to manage it. So, how can you manage pelvic pain during pregnancy? Let's dive right in. The most crucial strategy is balance, alternating between periods of rest and physical activity. Understand that your lower back and pelvis only truly relax when you're lying down. Take 15-minute breaks a few times a day to lie down, giving your body a chance to recover. Avoid long periods of standing or sitting, and ensure you change your position regularly. Try to walk leisurely for about 10 minutes twice a day. Remember, these walks should be stress-free, without any shopping bags or children to look after. Activities such as cycling, swimming, and walking are beneficial as they strengthen muscles and improve your fitness. It's also essential to get into the habit of slightly contracting your lower abdominal muscles. Think of it as gently pulling your lower abdomen in. It might require conscious effort initially, but soon it'll become second nature. Another crucial point is to avoid arching your back. Always tilt your pelvis slightly backwards, which will flatten your back a bit. By doing this, along with tightening your abdominal muscles, you're working on both the deep abdominal and back muscles, providing better support for your pelvis. Interestingly, recent studies show that women who exercise 3 times a week before pregnancy experience less pelvic pain. So maintaining a healthy, active lifestyle even before you're expecting can have long-term benefits. With these strategies, you can effectively manage pelvic pain and enjoy a more comfortable pregnancy. Let's quickly run through the key points we've discussed. Pelvic pain during pregnancy is common, but manageable. Balance your physical activity with periods of rest. Walk leisurely twice a day, and always remember to strengthen your abdominal and back muscles. A supportive belly band can also provide relief. But remember, every pregnancy is unique, and what works for one may not work for another. Always consult with your healthcare provider if you have concerns about pelvic pain during your pregnancy. Until next time, take care of yourself and your little one on the way.